Nurse Macy. I create videos on health, especially fertility, pregnancy, labor and delivery, family planning and parenting. And you're welcome to my YouTube channel. If this is your first time visiting, kindly click on the subscribe button to get notified when a new video is uploaded. The body of a pregnant woman shows when the fetus is healthy or unhealthy. It's important for one to be aware of all the possible signals that the body might show in case of any issue that affects the fetus. In this video, I will explain the 14 signs of an unhealthy fetus. 1. Sudden discontinuation of morning sickness. Morning sickness and pregnancy are correlated and is one of the signs of healthy pregnancy. Usually, morning sickness resolves itself by the end of first trimester or even earlier without affecting the fetus. However, for some pregnant women, sudden discontinuation of morning sickness might be because of low HCG levels, pointing to miscarriage. It is advised to seek an expert's opinion and make sure there is no threat to your baby. 2. No fetal movement. Fetal movement can be felt around 18 to 20 weeks as the fetus starts reacting to sound, light, and pain. Experts say that a pregnant woman should experience around 10 kicks every 2 hours during this period. If the fetus is in distress, the count declines. It is a clear sign to consult your doctor for proper treatment. Any delay in seeking medical help might cause an unfortunate event. 3. Changes in placental position. A change in the placental position is also one of the signs of an unhealthy pregnancy. When the placenta detaches prematurely from the fetus, the pregnancy gets terminated, so always get placental position checked. 4. Sudden spike in blood sugar level. It's normal for blood sugar and blood pressure levels to rise during pregnancy. In fact, you should keep these levels throughout the 3 trimesters. However, a sudden rise in blood sugar level could lead to preeclampsia and may induce preterm labor. 5. Contraction of breast size. During pregnancy, the body of a woman goes through a multitude of hormonal changes. Breasts go through a transformation and become more sensitive. They also feel heavier and fuller as the pregnancy progresses. However, a sudden decrease in the size of breast may signal a miscarriage. 6. Fever during pregnancy. Fever might pose the threat of a bacterial or viral infections to the mother and fetus, so fever during pregnancy should not be ignored. Always visit the clinic for prompt management. 7. Vaginal discharge during pregnancy. Vaginal discharge is a common condition experienced by women that are pregnant, and it increases as the pregnancy progresses. Usually, the vaginal discharge of a pregnant woman is clear, transparent, whitish, and odorless. However, if you notice yellowish or greenish discharge with a strong smell, it is time to consult your doctor without any further delay. Unusual discharge might be caused by cervical inflammation, indicating a sign of miscarriage. 8. Extreme back pain. Experiencing back pain is common during pregnancy as the growing baby puts a lot of strain on the spine and lower back. These feelings worsens when you're expecting multiples. Well, look out for back pain which becomes severe as opposed to a dull ache in the back. If the pain starts from the front of your body and makes its way to the back, it's not a good sign. So, visit your doctor immediately. 9. Bleeding during pregnancy. Women tend to experience spotting during pregnancy, which is quite normal. However, bleeding is still a matter of concern without a doubt and needs to be evaluated by a doctor. It might be a sign of miscarriage, hormonal bleeding, or implantation bleeding. 10. Excess cramping during pregnancy. Pregnancy comes with its own pain and aches. However, extreme pain, which feels like menstrual cramp, is another warning sign. In early pregnancy, it may be caused due to poor blood flow, but if it persists, you have to see your doctor. 11. Low HCG level. HCG is a type of hormone produced by the placenta during pregnancy, so the level tends to fluctuate during pregnancy depending on the trimester. Generally, HCG levels are extremely high during 9 to 16 weeks of pregnancy. The normal levels vary from individual to individual, so a low HCG level is not a reason for you to panic. However, miscarriage or ectopic pregnancy may induce a low level of HCG and raise a red flag for your pregnancy. 12. Abnormal fundal height. Fundal height helps the doctor evaluate whether a woman's uterus is growing or not. To measure fundal height, you'll be asked to lie down and using a tape measure the length from top of uterus to pubic bone. Usually after the 16th-week mark, fundal height matches the progress of the pregnancy. If the height of your uterus is not what it should be, it indicates a problem with your pregnancy. The reason may be too much or less of amniotic fluid or a breech baby. It could also mean that the fetus is not developing very well. 13. Lack or no heartbeat. Although a baby's heart starts beating after the 5th week, it's only around the 10th week that the detection becomes easy. A fetal heartbeat can be detected through electronic fetal monitoring or placing a fetoscope on your stomach and counting the number of beats per minute. At times, detecting the heartbeat may not be possible due to a change in the position of the baby or placenta issues. In such cases, your midwife or doctor might ask you to try again during your next visit. However, if she can't still detect the fetal heartbeat, then an ultrasound test might be recommended to dig out the reason behind the undetectable heartbeat. In some cases, lack of heartbeat signals a lifeless fetus. 14. Intrauterine growth restriction (IUGR). It interferes with the growth of the fetus. If you test positive for IUGR, it implies your fetus measures 10% smaller than its gestational age. If you're suffering from intrauterine growth restriction, complications such as difficulty in breathing, high blood sugar, and high body temperature can arise and continue even after delivery. Therefore, there is need to closely observe this condition. This could happen in case of multiples as well, where one of the babies suffers from IUGR, but the other one remains unaffected. It happens due to abnormal function of placenta, which in normal condition ensures the baby gets all necessary nutrients. Other reasons include kidney issues, anemia, and diabetes. Thank you for watching. If you like this video and you would like to watch similar videos from this channel, please subscribe and tap the bell icon.